My name is Mostafa Ghanim. I'm the Interventional Cardiology Fellow in Mercy One, North Iowa. I have actually a very close family members who was like a role models for me, and they were physicians, and I saw how they impact their surrounding people and everyone, so that's how I decided to go into medical school. I was born and raised in Cairo, Egypt, and I did my medical school there as well, in Cairo University, and afterwards I decided to pursue further postgraduate training in the US. So I moved to Boston, which was my first step where I did my internal medicine training for 3 years, and after that I knew I wanted to do cardiovascular medicine, so I moved here to Iowa to pursue cardiovascular training. I have to say cardiology fellowship is pretty competitive. However, coming here has a lot of advantages. Being the only tertiary center in North Iowa with a lot of catchment area of referrals from a lot of hospitals around us, give us a chance to see a lot of diverse cardiovascular diseases and have to deal with a lot of more interventions that I wouldn't do in a more competitive market somewhere else. So for example, here we do a lot of cardiovascular coronary artery interventions, peripheral artery interventions. We also do some structural procedures like transcatheter aortic valve replacement. Plus, for our heart failure population, we recently have been placing those sensors in the pulmonary artery, which give us more information that help us keeping them outside the hospital and improve their quality of life. So my first exposure to the cath lab was during my general cardiology fellowship, and I noticed, first of all, how busy our cath lab is, and I noticed how all the interventional attendings are very keen about education and having a priority for their interventional fellow to learn as much as they can during their fellowship training. And that's one of the most important reasons I decided to pursue further training in that field. If you're interested in community medicine, seeing pathology and seeing patients and diverse population with a lot of cardiovascular disease and having hands-on skills in a busy place, I think Mason City offer all of that, especially here in our cath lab. The most rewarding part of my job is when I see someone who's come suffering with maybe a heart attack, coming to the emergency department and being able to emergently take him to the cath lab and do some kind of intervention to relieve this pain and protect him from having a life-threatening heart attack. Seeing patients afterward and their family and seeing how they are appreciative is a most rewarding part of my job.